I'm Craig Page. I'm the General Manager of Podiatry at Healthia.
My name's Ollie. I'm a podiatrist. I studied at QUT.
Podiatry is a combination of medicine, it's a combination of biomechanics, and so effectively that would be someone who's getting injured based on the exercise they're doing.
I think a lot of people just think it's skin and nails or it's just a foot, but really we do, to a degree, hip down, musculoskeletal, vascular, work with pain, we work with neuromuscular deficits, congenital deformities and disease.
It might be helping a physiotherapist or a treating allied health professional who's treating that person manage their load. So a lot of the tools that we use in podiatry with orthotics, the way we can redistribute force based on the position of the foot determines how much you load and deload that structure.
I couldn't recommend it more. The scope of practice is so broad. You could find yourself working in a private clinic, doing a whole range of things. You could find yourself working as a sports podiatrist.
QUT graduates are very, very good at their biomechanics, so that QUT puts a lot of focus on biomechanics, as well as the general podiatry and high-risk podiatry, paediatrics. So QUT is good in that you do your hospital placement and you do your high-risk placement, but there's also a large focus on private practice. QUT students come out because they've done placement in private clinics and private practices. They are aware of what it is, and it might be even just HICAPS codes, so it might even be knowing the codes for private health funds. It would be also grinding orthotics, so grinding an orthotic and making orthotics is a real skill.
So you'll get to design, manufacture and fit an orthotic all in the same kind of month, which gives you that whole start to finish experience. I think the best thing that QUT Podiatry has to offer is the on-site clinic. Truly starting to see patients from the second year gives you the confidence to hit the ground running, and by the time you do graduate and start seeing patients, you've seen so many of the different things that you're going to see in the real world.
For me, as someone who employs the students, I find they're a more well-rounded student. The other thing is obviously even just communication with patients, learning how to implement a treatment plan. I find our QUT students are probably ahead when it comes to implementing a treatment plan and knowing what to do. So it's one thing diagnosing because you've learnt the material and you've learnt the pathology and you learn how to diagnose. It's another thing then to be able to implement a treatment plan that goes out not 1 week, 2 weeks, 3 weeks, but over the course of 3 months, I suppose. The placements for senior students, for students in their 3rd and 4th year is critical to being job ready. I
got this job well before we started doing placements. In doing so, had access to an informal placement for years, which really accelerated my learning and consolidated a lot of things that I'd heard about in uni. It's well known that podiatry has a really high uptake rate. I can't think of anyone that I graduated with that didn't get a job almost off the bat. I think first and foremost, working with patients is really gratifying, and seeing positive, tangible change it's awesome. That's why people probably get into health. For me, working with technologies and new innovative forms of treatment, working with 3D printing, scanning to make bracing, prosthetics and devices like that really excites me.